After over 3 years of negotiations, member states have agreed on a legally binding global pandemic treaty to tackle future pandemics more effectively. But here's the twist: the United States isn't part of it. So, what does this pandemic treaty really mean for the world? Before we begin, don't skip, try to read and listen. If you are new, don't forget to subscribe, it really motivates us to create helpful videos. Back in 2021, during the COVID-19 Omicron wave, vaccine inequality was a huge issue. Rich countries stockpiled vaccines, while many poorer nations had none. Over 1 million lives could have been saved if vaccines had been shared more fairly. To prevent that from happening again, who initiated this global pandemic agreement? The treaty focuses on equity, preparedness, and transparency. One major point is a pathogen access and benefit sharing system. That means when a new virus is discovered, pharmaceutical companies will get access to its data, like genetic sequences, in exchange for promising to share 10% of their pandemic products with the WHO. Another 10% must be sold at affordable prices. That includes vaccines, diagnostics, and treatments, especially important for developing countries. Also, countries are encouraged to share technology and manufacturing know-how so that more nations can produce their own vaccines in the future. And when governments fund research, they'll need to make sure any resulting drugs or vaccines are accessible during pandemic. Think of it like putting public good over private profit. But here's the catch: this treaty is not enforceable. The WHO can't force countries to follow it. It can't make governments impose lockdowns, vaccine mandates, or even share medicines. Clause 24 specifically says, WHO doesn't have the power to change any country's domestic policies. And remember, the US didn't sign on. When President Trump returned to the White House, he pulled the US out of the negotiations. Considering the US leads in vaccine and drug production, its absence creates a major gap in this global deal. Experts are divided. Some say it's a historic step toward global health equity. Others say without enforcement or US support, it might be just another paper agreement. What do you think? Is this treaty strong enough to make a real difference when the next pandemic hits? Let us know in the comments.